Have you ever experienced less firmness than in your youth? Noticing that your penis doesn't achieve the full rigidity it used to have? Or that you lose firmness during sexual activity? Or that your spontaneous morning erections have almost completely disappeared? Have you assumed that this loss of erectile quality is an inevitable consequence of aging, something you simply have to accept without any possibility of significant improvement? Have you spent money on supplements promising to increase blood flow to the penis without getting measurable results? Or have you considered medications like sildenafil or tadalafil? But do you prefer to explore natural options without side effects before resorting to pharmacotherapy? Did you know that there are three specific categories of physical exercise with robust scientific evidence demonstrating that they improve endothelial function? They increase production of vasodilatory nitric oxide, reduce peripheral vascular resistance, and consequently improve erection quality, objectively measured with a regimeter and validated questionnaires. If you're over 40, if your erections have gradually lost firmness, if you want to improve your erectile function naturally through lifestyle interventions before needing medications. Or if you already take phosphodiesterase type 5 inhibitors but want to enhance their effect by reducing the necessary dose. This message is absolutely crucial for your sexual and cardiovascular health. I'm Dr. Sánchez, a specialist in preventive medicine and men's health, and today I'm going to reveal to you the three specific types of physical exercise that improve blood flow to erectile tissue according to controlled clinical studies. What exact physiological mechanisms mediate this improvement, including endothelial production of nitric oxide and vascular remodeling? What specific protocol of frequency, intensity, and duration do you need to follow to achieve measurable improvements in 8 to 12 weeks? And why is cardiovascular exercise the most effective intervention for mild to moderate erectile dysfunction, with a response rate over 50% without medications? Stay until the end because this information, based on cardiological and urological literature, can restore erectile function naturally, simultaneously reduce your cardiovascular risk, and give you an effective medication-free alternative with additional benefits for overall health. To understand why specific physical exercise improves erectile function and which types of exercises are most effective, you first need to understand the basic physiology of erection and why circulatory problems are the most common cause of erectile dysfunction in men over 40. Erection fundamentally depends on adequate blood flow to the corpora cavernosa of the penis. During sexual arousal, nerve stimuli release nitric oxide in the endothelium of the penile arteries. Nitric oxide activates the enzyme guanylate cyclase, which increases production of cyclic guanosine monophosphate. This second messenger relaxes the smooth muscle of the arterial walls, causing massive vasodilation. The penile arteries, which in a flaccid state have a diameter of 1 to 2 millimeter, dilate up to 3 to 4 million, allowing blood flow to increase from 10 milliliter per minute in the flaccid state to 50-100 milliliter per minute during erection. This flow fills the lacunar spaces of the erectile tissue until reaching an intracavernosal pressure of 80 to 100 Mg, producing complete rigidity. Simultaneously, the drainage veins are compressed against the tunica albuginea, trapping blood inside the corpora cavernosa. A mechanism called veno-occlusion. The quality of erection directly depends on arterial dilation capacity and vascular endothelial health. With aging, smoking, diabetes, hypertension, high cholesterol, and a sedentary lifestyle, the vascular endothelium suffers dysfunction, characterized by reduced nitric oxide production, increased oxygen-free radicals, low-grade chronic inflammation, and the development of atherosclerotic plaques that obstruct arteries. The penile arteries, being the thinnest in the body, are affected first before the coronary or cerebral ones. That's why erectile dysfunction is frequently the first symptom of systemic cardiovascular disease, preceding myocardial infarction by an average of 3 years. Epidemiological studies show that men with erectile dysfunction have an 80% higher risk of coronary disease, stroke, and cardiovascular mortality over the following decade. This connection between vascular health and erectile function is key. Any intervention that improves systemic endothelial health will simultaneously improve erectile function. Imagine for a moment the devastating frustration you experience when your erections, which were once as firm as steel, reaching 90 to 100% full rigidity, now barely reach 60 or 70% firmness. Enough for initial penetration, but progressively losing rigidity during sexual activity, forcing you to finish quickly before completely losing the erection. You try multiple times, but the result is the same. Mediocre erections, growing anxiety, avoidance of sexual intimacy due to anticipated fear of failure. Your partner notices you're distancing. Your sexual self-esteem plummets. You consult a doctor who prescribes 50 mg sildenafil. It works by improving firmness, but you experience bothersome side effects: intense headache, nasal congestion, facial flushing, visual alterations with a blue tint. Plus, you don't want to depend on medication every time you want intimacy. You prefer a natural solution, but you don't know what to do. You've tried supplements like L-arginine, ginseng, maca without measurable results. Meanwhile, your erectile function continues to deteriorate slowly because the underlying atherosclerosis progresses. Don't you know that there is a lifestyle intervention with scientific evidence as robust as medications for mild to moderate erectile dysfunction? Structured, specific physical exercise that improves endothelial function, increases nitric oxide, and reverses erectile dysfunction without medications or side effects. This lack of information keeps millions of men suffering unnecessarily or depending on medications when they could improve naturally with the right exercise protocol. Many men have misconceptions about exercise and erectile function. Some believe that any physical exercise automatically improves erections, when the reality is that the specific type, intensity, duration, and frequency determine effectiveness. Intense anaerobic exercise, like maximum weightlifting, does not significantly improve endothelial function. Others believe that Kegel exercises are sufficient when Kegels improve rigidity and ejaculatory control, but do not treat the underlying vascular cause if there is atherosclerosis. Some try occasional exercise twice a month and see no results because the frequency is insufficient to induce vascular adaptations. Others do intense daily exercise but never include a flexibility or relaxation component that reduces sympathetic tone. Before you continue exercising without a specific strategy, let me reveal to you the 3 types of exercise with the strongest scientific evidence for improving erectile function and the exact protocol you should follow. The first type of exercise with the most robust evidence is moderate intensity aerobic cardiovascular exercise, performed consistently 4 to 5 times a week for at least 40 minutes per session. Aerobic exercise includes brisk walking, jogging, swimming, cycling, rowing, elliptical. Any activity that raises your heart rate to 60-70% of your maximum frequency, calculated as 220 minus age in years, during a sustained period. The mechanism by which aerobic exercise improves erectile function is multifaceted. First, it increases endothelial nitric oxide synthase expression, the enzyme responsible for nitric oxide production in all arteries of the body, including penile ones. Studies show that 8 weeks of aerobic exercise increased nitric oxide synthase expression by 40%. Second, it reduces oxidative stress, decreasing production of free radicals that degrade nitric oxide. Third, it improves insulin sensitivity, reducing insulin resistance, which is a major risk factor for endothelial dysfunction. Fourth, it reduces systemic inflammation by decreasing C reactive protein, interleukin 6, and tumor necrosis factor alpha. Fifth, it promotes angiogenesis, the formation of new capillaries that increase vascular density in tissues. Sixth, it reduces blood pressure by 5 to 10 mmHg systolic and 3 to 5 diastolic. Seventh, it improves lipid profile by increasing protective HDL cholesterol and reducing triglycerides and atherogenic LDL cholesterol. The most important study demonstrating the effectiveness of aerobic exercise was published in the Journal of the American Medical Association in 2011. Italian researchers recruited 110 sedentary men aged 40 to 65 with mild to moderate erectile dysfunction, documented by an International Index of Erectile Function, score below 22 points. They divided them into two groups. The intervention group received a structured aerobic exercise program consisting of 40 minutes of brisk walking or light jogging 5 times a week for 24 weeks. The control group received only education on healthy lifestyle without structured exercise. After 6 months, the exercise group showed an average improvement of 5 points on the International Index of Erectile Function, with 33% of participants achieving a clinically significant improvement greater than 4 points. The control group showed no change. The men with the greatest improvement were those who adhered to more than 80% of the scheduled sessions, and those with mild versus severe erectile dysfunction. Additional studies show similar results. Aerobic exercise improves erectile function in 40 to 50% of men with mild to moderate dysfunction without medications. Recommended specific protocol: 40-60 minutes of moderate intensity aerobic exercise, 5 days a week. Moderate intensity means you can maintain a conversation with slight difficulty but not sing. Use a heart rate monitor to stay at 60-70% of maximum frequency. Minimum 8 weeks to see initial improvements. Optimal 12 to 16 weeks for maximum benefit. Improvements are maintained with continuous exercise but are lost if suspended, so it must become a permanent habit. The second critical type of exercise with specific evidence for erectile function is pelvic floor exercises, or Kegel exercises for men. Although Kegels are widely known for postpartum women, they are equally important for men with erectile dysfunction. The male pelvic floor includes the bulbocavernosus, ischiocavernosus, and levator ani muscles that surround the base of the penis and share innervation with the erection mechanism. During erection, these muscles contract rhythmically, compressing the base of the corpora cavernosa, increasing intracavernosal pressure from 80 to 120-140 mmHg during the maximum rigidity phase. In men with weak pelvic muscles due to sedentary lifestyle, aging, or prior pelvic surgery, this compression is insufficient, resulting in less rigid erections and premature loss of firmness. Additionally, strong pelvic muscles improve ejaculatory control, allowing voluntary interruption of the ejaculatory reflex. A British study published in the British Journal of General Practice in 2005 followed 55 men with erectile dysfunction who performed a pelvic exercise program supervised by a specialized physiotherapist. The protocol consisted of 3 sets of 10 contractions lasting 8 to 10 seconds, 3 times daily for 3 months. Evaluation at 3 months showed that 40% of participants recovered normal erectile function, defined as an International Index of Erectile Function score above 25 points. 35.5% showed significant improvement. Only 25% did not respond. Improvement was greater in men under 60 and without severe comorbidities. Correct male Kegel technique. First, identify the correct pelvic muscle by trying to stop urine flow during urination. The muscle you contract is the target. Do not contract glutes, abdomen, or thighs. Second, in a sitting or lying position, contract the pelvic muscle as if trying to stop urine and lift the testicles toward the body. Hold the contraction for 5 seconds initially. Relax for 5 seconds. Third, perform sets of 10 contractions 3 times daily, morning, afternoon, night. Fourth, after 2 weeks, increase contraction duration to 8 seconds, then to 10 seconds in week 4. Fifth, starting from week 6, also perform quick contractions. Contract and relax rapidly 10 times in a row. Practice for at least 3 months to see maximum benefit. Advantage of Kegels: they can be done discreetly anywhere without special equipment. The third beneficial type of exercise is flexibility, stretching, and relaxation exercises, specifically yoga or Tai Chi, which reduce sympathetic nervous system tone and improve peripheral blood flow. Erectile dysfunction has a significant component of chronic sympathetic nervous system activation due to stress, anxiety, and muscle tension. The sympathetic system releases norepinephrine, which causes arterial vasoconstriction, opposite to the vasodilation needed for erection. That's why performance anxiety causes or worsens erectile dysfunction. Yoga exercises, especially postures that stretch the pelvic area and promote relaxation, reduce sympathetic activation, increasing parasympathetic tone that favors erection. An Indian study published in the Journal of Sexual Medicine in 2010 evaluated 40 men aged 24 to 60 with erectile dysfunction who practiced yoga for 60 minutes daily for 12 weeks. The protocol included specific postures: Paschimottanasana, seated forward bend; Uttanasana, standing forward bend; Dhanurasana, bow pose; Halasana, plow pose; and Savasana, final relaxation with conscious breathing. After 12 weeks, participants showed significant improvement in all domains of the International Index of Erectile Function: sexual desire, erectile function, satisfaction with intercourse, and overall satisfaction. Additionally, they reported reduced anxiety and improved psychological well-being. Proposed mechanisms include improved pelvic muscle flexibility, increased blood flow from inverted postures, reduced cortisol, stress hormone, and improved body awareness. Recommended protocol: practice yoga or Tai Chi for 30-60 minutes 3 times a week, focusing on postures that stretch the hips, inner thighs, and pelvic region. Always include deep conscious breathing practice that activates the parasympathetic system. If you're a beginner, consider classes with a certified instructor to learn correct technique and avoid injuries. Alternative: static stretches for thighs, hips, and lower back region for 15-20 minutes daily, combined with meditation or deep diaphragmatic breathing. The optimal integrated protocol that combines the 3 types of exercise for maximum benefit consists of the following structured weekly plan: Monday, Wednesday, Friday. Aerobic exercise 40-60 minutes at moderate intensity, followed by 15 minutes of stretching and 5 minutes of conscious breathing. Tuesday, Thursday, Saturday. Yoga or Tai Chi, 60 minutes with emphasis on pelvic postures. Sunday, active rest with a light 30-minute walk. Additionally, Kegel exercises, 3 sets of 10 contractions daily every day, independent of other exercise, as they only take 5 to 10 minutes total. This protocol provides sufficient cardiovascular stimulus, specific pelvic strengthening, and stress reduction, combined with optimization of other lifestyle factors. Mediterranean diet rich in vegetables, fruits, fatty fish, olive oil, nuts that improves endothelial function. Eliminate tobacco completely because smoking causes chronic vasoconstriction. Moderate alcohol to a maximum of 2 drinks daily. Sleep 7 to 8 hours daily for adequate hormonal recovery. Maintain a body mass index below 28 because obesity is associated with chronic inflammation and insulin resistance. Control blood pressure below 130/80. LDL cholesterol below 100 NDL, and hemoglobin A1C below 5.7% in diabetics. These factors work synergistically to maximize erectile function improvement. Visualize Ricardo, 52 years old, who suffered from moderate erectile dysfunction for 3 years. His erections reached only 60% firmness. International Index of Erectile Function was 18 points, moderate dysfunction. He took 10 milligram tadalafil, occasionally with partial improvement but bothersome side effects. He was sedentary, worked sitting 8 hours daily, body mass index of 31, total cholesterol of 240 mRDL. His doctor explained that his erectile dysfunction was vascular caused by initial atherosclerosis and recommended an exercise program before increasing medication dose. Ricardo implemented the protocol: light jogging 40 minutes 5 days a week, yoga 30 minutes 3 days a week, Kegels 3 sets daily. Additionally, he adopted a Mediterranean diet and lost 8 kilos in 4 months. Evaluation at 12 weeks showed dramatic improvement. International Index of Erectile Function increased to 24 points, mild erectile function. His erections reached 80–85% firmness without medication. He reduced tadalafil to occasional use once a week. At 6 months, the index was 26 points. Normal function. Ricardo says, "I never imagined that exercise could improve my erections as much as medication. I recovered function without side effects and also lowered blood pressure, improved cholesterol, have more energy. Exercise changed my sex life and overall health." It is essential to clarify that if you have severe erectile dysfunction with erections below 30% firmness, if you have uncontrolled diabetes with hemoglobin A1C above 8%, if you've had a prior heart attack, cardiac surgery, or radical prostatectomy, exercise alone may be insufficient and you need specialized medical evaluation, considering combined therapies of exercise plus medications, possibly intracavernosal injections or prostheses. Before starting an intense exercise program, especially if you're over 60 or have multiple cardiovascular risk factors, consult a doctor for risk assessment and possible cardiac stress tests to rule out severe coronary disease. Moderate aerobic exercise 5 days a week, Kegel exercises 3 times daily, and yoga 3 days a week improve erectile function in 40–50% of men with mild to moderate dysfunction through improved endothelial function, increased nitric oxide, pelvic muscle strengthening, and stress reduction. The protocol requires a minimum 12-week commitment. Results are maintained with continuous practice. Combine with a healthy diet, smoking cessation, weight control, and optimization of cardiovascular risk factors. If you need a prior cardiovascular evaluation with a stress test and complete lipid profile available in cardiology for €150–300, it's an investment in health that can prevent a heart attack and improve sexual function simultaneously. If this information gave you an effective natural alternative, like, subscribe, share. I'm Dr. Sánchez. See you soon.